One of the most common things patients tell me is this: Doc, I just want a Botox. I don't want a fillers. And I usually pause not because they are wrong, but because I'm not sure what they think Botox actually does. If you've ever been told these are basically the same things, this is for you. Botox and fillers are spoken about like they are, how you said, interchangeable. Same needle, same face, same appointment, but they solve opposite problems. No one slows down long enough to explain that. Here is the simplest explanation I know. Botox treats movement. Fillers treat volume. Botox relaxes muscle. Filler restore or support structure. So different layers, different jobs, different consequences. This is where the logic breaks. If Botox removes movement and filler add volume, how did we end up talking about them as if they are the same thing? Same syringe does not mean same job. When you treat movement like volume or volume like movement, you don't just get a bad photo. You actually change how the face ages. That's why results sometimes look heavy, flat, or just off. So, why people misunderstand it? First, the marketing bundles everything together. Big mistake. Social media shortens explanation. Results are shown, mechanism is not. So people hear wrinkler treatment and stop listening. So the assumption becomes if it smooths line, it must be Botox. Not always. This is what happened in real life. Botox, wrongfully used when volume loss is the problem, will give you a face of a tired, hollow look. When filter wrongfully used when muscle movement is the problem, it gives the look of a heavy and natural look. When both done without a plan, it will be confusion. No one can explain. Patient don't know why it is, but it looks wrong. They just know it doesn't feel like them. And this is the invisible variable. At this point, the product matters less than the decision making behind. Remember that. The real variable is not Botox versus filler, it's a judgment. You know, as a surgeon, anatomy is how we think. As an immigrant physician, maybe I notice confusion faster because I had to learn everything from the first principles. Faces don't forgive shortcuts. Sometimes either treatment is perfectly appropriate, but it should never ever be assumed. If every wrinkle needs Botox, surgeon would not need anatomy book. We would need a menu. Before agreeing to any injection, listen up. Ask, is this wrinkle from movement or volume loss? What problem are we actually treating? The right question is not Botox or filler. It is what is in my face trying to solve right now? If no one can explain that, clearly. Pause. If this raised questions for you, your first evaluation is free. At this stage of my career, I'm offering clarity, not another bill. Hit follow to help build momentum to fix healthcare in America. And please, if you see a flaw in this logic, tell me. I'm genuinely curious. This is Dr. Ben Mommer, surgeon first, clarity always.